So we're Team Holy Walkamolies, and this year for our Relay Where You Are Fightback activity, we're presenting a video on uterine cancer. So uterine cancer is also known as endometrial cancer, and it's a tumor on the lining of a woman's uterus that is normally shed during menstruation. It occurs when normal cells that make up the endometrium mutate and multiply. The most common symptom of uterine cancer is unusual vaginal bleeding and discharge. You can detect uterine cancer through a pelvic exam, and it's crucial for a healthy outcome. So here we have an animation video of uterine cancer that depicts the endometrium, the uterus, and exactly what uterine cancer is. So here are some symptoms of uterine cancer. So if you have vaginal bleeding after menopause, bleeding between periods, pain or a mass in the pelvic area, difficult or painful urination, abnormal vaginal discharge, or unintended weight loss, you might have uterine cancer because these are all symptoms. So who's at risk for uterine cancer? So overweight people, people who started their period at a young age, people on estrogen supplements like estrogen pills, pregnant people, and people with polycystic ovarian syndrome or certain ovarian tumors are at risk for uterine cancer. This type of cancer is rare, and there are less than 200,000 cases in the U.S. every year. As of 2016, an estimated 772,245 women in the U.S. had uterine cancer. So how do you treat uterine cancer? So first, you can treat it through surgery. An oophorectomy is the surgical removal of one or both ovaries. A cervicectomy is the surgical removal of the cervix, which is the lower part of the uterus that connects to the vagina. A lymph node dissection is the surgical removal of a lymph node. A salpingectomy is the surgical removal of one or both of the fallopian tubes, which carry eggs from the ovaries to the womb, which is the uterus. And lastly, there's the hysterectomy, which is the surgical removal of the womb or uterus. In more severe cases, radiation therapy or chemotherapy may be used. For radiation therapy, either a vaginal brachytherapy or pelvic radiation or some combination of the two might be used to treat uterine cancer. Lastly, hormone therapy might be used to treat uterine cancer. So what can we do to make sure that we're not at risk for uterine cancer? The good news is uterine cancer is one of the more rare types of cancer. That being said, here are some methods of prevention. So maintaining a healthy weight will make sure that you're less at risk for uterine cancer. This is because people that are overweight have certain hormone imbalances in their system, which makes them more at risk for this type of cancer. To help you maintain a healthy weight, you should look into having a more proper diet that avoids animal fat and estrogen in an imbalance. If you're on birth control pills or using an intrauterine device for birth control, you might be less at risk for this type of cancer. Most importantly, good disease management and regularly monitoring blood glucose levels can make sure that you don't have uterine cancer. If you suspect that you might have uterine cancer, you can test this through an endometrial biopsy or transvaginal ultrasound if needed. So how can you help people with cancer? So you can either donate to the American Cancer Society, which is the organization that does Relay for Life, or other cancer support charities, or volunteer for these organizations. But most importantly, make sure to support your loved ones who might be battling cancer. Cancer is hard, but with your help, we can make a cancer-free world a reality. Be there for your friends and family members so they don't have to go through it alone, because cancer is certainly a struggle in today's world.